Welcome to Rwanda Medical Academy. Today's lesson is about potential causes of congestive heart failure exacerbation. And we will use the mnemonic, FAILURE, to help you remember all those causes. First, let's see what congestive heart failure, CHF, is. Congestive heart failure, CHF, is a complex clinical syndrome where the heart is unable to efficiently pump blood, leading to compromised myocardial performance. Symptoms include shortness of breath, fatigue, and swelling due to fluid retention. It develops over time and can result from various underlying conditions, such as coronary artery disease or hypertension. Exacerbations of CHF are critical events that often require immediate intervention to prevent further complications. Understanding the mnemonic, FAILURE, can aid healthcare professionals in identifying potential causes of CHF exacerbations promptly. In today's lesson, we provided a detailed explanation of each component of the mnemonic along with its rationale. And, jumping onto our mnemonic, FAILURE, let's explore each component. F stands for forgot medication. Patients with CHF often require a regimen of medications to manage symptoms and improve cardiac function. Forgetting or missing doses of prescribed medications, such as beta blockers, ACE inhibitors, or diuretics, can lead to inadequate control of fluid retention and worsening heart function. A stands for arrhythmia and anemia. Arrhythmias, such as atrial fibrillation or ventricular tachycardia, can precipitate CHF exacerbations by altering the heart's rhythm and reducing its efficiency. Additionally, anemia, characterized by low red blood cell count or hemoglobin levels, decreases the blood's oxygen carrying capacity, thereby increasing cardiac workload and exacerbating CHF symptoms. I stands for ischemia, infarction and infection. Ischemic events, including myocardial ischemia or infarction, can directly compromise cardiac function and precipitate CHF exacerbations. Furthermore, infections, particularly respiratory tract infections or systemic infections, can trigger inflammatory responses and increase metabolic demands, thereby worsening CHF symptoms. L stands for lifestyle. Example, taken too much salt. Excessive dietary sodium intake can lead to fluid retention and exacerbate volume overload in patients with CHF. Consuming foods high in salt content can contribute to elevated blood pressure and exacerbate heart failure symptoms, including dyspnea, edema, and fatigue. U stands for upregulation of cardiac output. Example, pregnancy, hypothyroidism. Physiological states associated with increased cardiac output, such as pregnancy or hypothyroidism, can strain the heart and exacerbate CHF symptoms in susceptible individuals. Pregnancy-induced changes in hemodynamics and hormonal fluctuations can place additional stress on the cardiovascular system, potentially precipitating CHF exacerbations. R stands for renal failure. Renal dysfunction, characterized by impaired kidney function and reduced glomerular filtration rate, can lead to fluid and electrolyte imbalances, contributing to CHF exacerbations. Decreased renal perfusion secondary to CHF can further exacerbate renal impairment, creating a vicious cycle of worsening heart and kidney function. E stands for embolism, pulmonary. Pulmonary embolism, the obstruction of pulmonary arteries by thrombi or emboli, can lead to acute respiratory compromise and exacerbate CHF symptoms. Reduced pulmonary blood flow and increased pulmonary vascular resistance can strain the right ventricle, leading to right-sided heart failure and exacerbating CHF exacerbations. Conclusion. The mnemonic, FAILURE, serves as a valuable tool for healthcare professionals to systematically evaluate potential causes of CHF exacerbations. By understanding and addressing the underlying factors contributing to CHF decompensation, healthcare providers can optimize management strategies and improve patient outcomes. Thank you for learning. Join and save a life with us at Rwanda Medical Academy.